Welcome to this video that will cover bones and the skeletal system. So first of all, you need to appreciate that there are two basic types of bone. In the histology lab, we looked carefully at compact bone. That was the bone with the osteons and the lamellae and the cantiliculi. We'll look at that again in a moment. But I want you to also appreciate that there is a second type of bone that is called spongy bone. You'll also see it referred to as trabecular bone. And this is the bone that is found inside your bones. It is much lighter in weight, has lots of spaces in it, helps to reduce the weight of our bones, but still contributes to the strength of bones. In this diagram, you're looking inside a bone. Let me just point out that the compact bone that we looked at under the microscope is only coming from this outside region, okay? That is the area where we have the lamellae and the osteons. Everything else on the inside is spongy bone. Now, in some of your bones, in the spongy bone is where there is bone marrow, specifically red bone marrow, and we'll discuss that again in a moment as well. Now let's get back to compact bone and what is bone made up of. Compact bone is made up of basically about 1/3 of organic materials. This is the collagen primarily. Recall that collagen provides tissues with incredible strength, and that is very obvious here in bone. Another third of bone is made up of inorganic or mineral content. This is a combination of calcium and phosphate, which is referred to collectively as hydroxyapatite. And then about 1/3 of your bone is water. There are other cells that also make up your bone: osteoblasts, osteoclasts, osteocytes. We'll look at those more carefully in lecture. You know that bone has osteocytes in it. That's what you know from the histology lab. When you think about bone, I want you to think about some of your travels along an interstate where they are building new roads. And oftentimes you will see what's called rebar put down. That is this collection of strong steel rods. And then on top of that rebar, you'll see concrete added. Well, that's sort of how our bones are put together. We have that 1/3 organic component, primarily made up of collagen, and that's like those strong steel bars of the rebar. In addition to that, there is the concrete. That is the inorganic component made up of hydroxyapatite. And here is the formula for hydroxyapatite. You see that it is calcium and phosphate, Ca and P. Don't worry about the specific arrangement of those atoms, but just know that it's a calcium phosphate matrix that makes up the inorganic portion of your bones. Perhaps you have put a bone in the oven in the past. Maybe you have taken a turkey bone or a chicken bone, the wishbone, and tried to crack it. You probably appreciate that after a bone is heated in the oven for quite some time, that bone changes its characteristics. So I want you to think for a second, when you put a bone in the oven for a couple of hours, what is being destroyed? Is it the collagen or is it the calcium phosphate? And you know from lecture that heat destroys, denatures proteins. So you could rightly determine that collagen is what is being broken down when bone is heated. And as a result, after a bone comes out of the oven, that bone is far more brittle, right? You have lost the strength of the collagen, but you have not destroyed the calcium phosphate. The hydroxyapatite is still that same mineral content. So as a result, the bone becomes more brittle. But have you ever put a bone into acid? Do you recall in elementary school having your teacher have you put like a chicken bone into Coca-Cola or into acid or into vinegar for a night or for a weekend? If you've ever done that, you know that the bone comes out very soft. It's very pliable. You can bend that bone once it has been put into acid for a while. Now, in that situation, the acid is not destroying the collagen, but the acid is breaking down the inorganic concrete, the hydroxyapatite component of your bone. So the collagen is still there. That bone will be pliable. You can bend it, but it's still very strong. It would be difficult to break the bone, but it does change its characteristics. And you know this to be true. This is why we watch commercials where we hear about the enamel on our teeth being broken down by the acidic foods that we eat, because enamel is essentially the same as bone. It is made up of this calcium phosphate matrix. You also know that acid rain and time do horrible things to statues. If you go to Greece and you look at outdoor statues, you will see that with the increase in acid rain, that statues are being degraded. Or if you go to a cemetery, you know that the etching on the cemetery plots is over time degraded from the acidity found in rain, and it's more problematic where acid rain is a bigger problem. So we've all seen that acid can eat away at minerals. So just think about what bone is made up of. It's an organic and an inorganic combination, and you know that both acid and heat can degrade bones. You've seen bone under the microscope. As a reminder, this is compact bone. You're seeing these large cylindrical units. Each of those large cylindrical units is referred to as an osteon. You'll also see Haversian system. In the very center, there's a central canal, where you might see it referred to as a Haversian canal. You know from our histology lab that the cells that reside in this bone, primarily osteocytes, and those osteocytes are hanging out in these spaces referred to as lacunae. Those lacunae and cells are arranged in these concentric layers. Each of those layers, recall, is referred to as a lamella, right? Lamella. Think laminated countertop, right? A layer, laminated lamella. And then finally, these osteocytes can't survive isolated within the hydroxyapatite of the bone. And so these lacunae are connected one to another through these stress lines. You can see the stress lines really nicely in this diagram. I'm kind of highlighting some of those stress lines. What those stress lines are small canals. And they connect one lacunae to another lacunae. That means that the blood that is traveling through the central canal is able to, through osmosis and through diffusion, is able to send necessary nutrients and molecules to these cells, but also to return waste products from these cells. So those canaliculi are necessary communication pathways for molecules to move from one cell to the next. So you've seen the two-dimensional or histological images of compact bone. Here is a three-dimensional model diagram of compact bone. And there is one additional structure that I want to point out that you can see here that we could not see in the histological images. Number one, this is the outside. Imagine this is a femur, right? This is a tall, very long bone. The femur is the longest bone in your body. And the bone is, let's say it's 2 feet long. We're looking at just a small fraction of that bone. So here would be the outside layer of that bone. Okay, there's the outside of that bone. And here we are seeing compact bone here, but in here we would see the spongy bone. So you can see the border between the compact bone and the spongy bone. In this diagram, the artist has done a nice job of showing you some of those osteons, right? You can see the osteons. You can see the central canal. What I really like about this drawing is that it reminds you and me that in those central canals, there are arteries, typically shown in red. There are veins, typically shown in blue. And there are nerves that are shown in yellow. So those central canals are very important routes for blood vessels and nerves to travel through and within bone. Bone is an incredibly vascular tissue. If you break a bone, it's a big bloody mess. In this diagram, the medical illustrator has also made a point of showing you these concentric layers. So here's an osteon, and they have shown the layers being pulled up, just to give you an idea of the number of layers in a single osteon. The one additional feature here, well, actually a couple of them that you can see. One, around the outside of the bone, there is a largely connective tissue layer called the periosteum, right? The periosteum. You'll see that written in other places. But peri, right, around the perimeter, periosteum. And that is, again, a connective tissue layer that is going to be around the entire bone. The other structure that I want you to see is that these central canals, right? Here's a central canal. Here's a central canal. These central canals are connected by these perpendicular canals, right? So there's one. Here's another one. Here's another one. And those canals are called the Volkmann canals. Okay, Volkmann canals. And those are also called perforating canals. Okay, perforating canals. And either name, Volkmann or perforating canals. And those are simply ways that one central canal can contact or make connection with another central canal. There is a three-dimensional model of bone that is in your Hebert Lab Atlas on page 58 that you may want to refer to. Let's also take a close look at the overall structure of long bones. Now, bones come in 4 or 5 different basic shapes. Long bones, short bones, sesamoid bones, irregular bones. Long bone is a good place for us to start. I forgot to say flat bones just a moment ago. And long bones and short bones essentially have the same architecture, the same anatomy. Let's take a careful look here at long bone anatomy. This will be one of the important diagrams for you to be able to label and understand. So let's take a look. On the left-hand side is a freshly cut bone, right? It represents a freshly cut bone. On the right-hand side, you have a much older, dried out bone. These both represent the femur. You can recognize that it's a femur in that there's a very large head to the bone, right? Very large head. And that's going to be characteristic and classic view of the femur as you get to know your bones. So on the left-hand side, a couple of things to point out. Number one, you can see that there is on the outside the compact bone. Okay, so that's the compact bone around the outside. On the inside, you have the spongy bone. Spongy bone. You can see it up here. Now, this spongy bone here is filled in the living bone or on the freshly cut bone with red bone marrow. Red bone marrow is where all of your bone cells are produced. So your red blood cells, your erythrocytes, white blood cells, the leukocytes, and platelets are produced in the red bone marrow. In a child, there is a significant amount of red bone marrow in many of the bones. In an adult, however, your red bone marrow is found in far fewer places. You'll only find red bone marrow in the proximal region of the femur and of the humerus. You'll also find it in flat bones, primarily. So we'll go over that more in lecture. So in an adult, you have red bone marrow, primarily just at the proximal end of the femur and the humerus, shown here in the femur. And then the middle of the bone is not filled with red bone marrow, but is filled with yellow bone marrow. Yellow bone marrow is basically fat. It's a filler found in the middle of the bones. Now, that yellow bone marrow can revert to becoming red bone marrow once again if there is a problem in bone marrow cell production. But primarily, your bones are filled with yellow bone marrow. This is why a dog gets really excited about getting a bone, right? It's not so much about the chewy bone, it's more about that fat on the inside. And it's also the reason why you throw a bone into a soup, right? You want that fat to leach out and to help flavor the soup. A couple of other things that I want to point out to you about the bone, long bone anatomy. Let's go through the terms. On each end of the bone, there is an epiphysis, epiphysis. Okay, and to understand this word, you need to appreciate that epi means on or upon, like the epidermis is on the dermis. And physis is a term that means growth. So on each end of the bone, long bone, there's an epiphysis, or we say there are two epiphyses. There's a proximal epiphysis, and there's a distal epiphysis. So what's this physis thing all about? Well, physis means growth. To understand this term, we need to appreciate that in bone, in young bone, there is a gap at each end of the bone called the epiphyseal plate. The epiphyseal plate is where bones are still growing longer in young people. Now, as an adult, the epiphyseal plate is gone, and we'll see this in lecture more thoroughly. But in an adult length bone, the epiphyseal plate is gone, and what you see instead is an epiphyseal line. So if you see this epiphyseal line, I'm highlighting it now, you can see it in an x-ray, you can see it actually looking at an actual bone. The epiphyseal line tells you that that bone has reached its adult length. This is why anthropologists and forensic scientists can look at a skeleton found years after death and determine the approximate age of that skeleton. There's a number of things they can do, but one of the markers, one of the things they're looking for is the presence of the epiphyseal lines, and this will give them an idea of how old that person was at the time of their death. These epiphyseal lines are formed in a different sequela, so they start in girls younger than boys, and they continue in some bones into the late teen years. And so there's a sequence of the bones forming these epiphyseal lines. A couple more things. Endosteum. Okay, endoosteum. So endo, within. Osteum, bone. So within the bone, there's a layer. Basically, this is the layer where the compact bone meets the spongy bone, right? So just think the endosteum is where the compact bone meets the spongy bone. I forgot to mention that the shaft of the bone, the majority of the bone length, is referred to as the diaphysis. So the ends are the epiphyses, and the shaft is referred to as the diaphysis. The way I remember this term is dia means across, like diameter. And you know from practical experience that bones, not only do bones get longer, but bones also grow in their diameter, right? The shaft of the bone gets thicker with age. And so I just remember that the shaft has a diameter to it, right? So the diaphysis is the way I remember that term. I already mentioned the periosteum earlier. That's the outer layer here. The periosteum's then peel back so that you can see that layer being pulled off the bone. One more thing that probably is not something you think about. When I think about bones, I think of bones as being these solid, structural things. Our muscles are attached to them. They are just kind of these sticks, basically, sitting in my body. I want you to kind of erase that thought about bones. Bones are living tissues. They are essentially the organs of the skeletal system, and they are very much, quote, alive, in that there are many cells within them. They are constantly changing. They have a metabolism. They're responding to the environment, the cells within them, and so to the tissues as well. And I'm showing you that bone has cells within it. That means that these cells must get nutrients. Don't forget, not only do we have osteocytes and other bone cells making up bone, but around the outside, there's connective tissues, right? That periosteum is made of connective tissues and fibroblasts. And don't forget that you have blood cells inside, and you have lots of blood vessels. Those blood vessels are lined by simple squamous epithelial cells. My point is, there are lots of cells that need nutrients. And so your bones are not just these solid sticks, but in fact, there are small openings. You can see them here on the old bone. There are small divots, small openings. They may not look like openings to you looking at a bone, but trust me, those little holes are there to allow blood vessels to travel in and out of the bone. Those are called the nutrient foramen. One of them is, and we're going to see this word a lot today, but the plural for foramen is foramina. Now that may not look like the plurality of foramen, but it is. So I want you to forget your English rules for a second. Foramen, right? E-N. It looks like plural, right? Because we think of men and man. But men is singular and foramina is plural. Okay, so it's a longer word, right? It's bigger. There's more of them. So one foramen, two foramina. So those are the terms I want you to know regarding the long bone anatomy. You're going to get a chance in mastering to practice and label more long bones. So as I mentioned in the previous slide, there's two types of bone marrow. Red bone marrow, that is where you actively have red blood cells, white blood cells, and platelets being produced. The term for blood production is hemopoiesis. So you'll see that term over and over this semester, and you'll see it especially when we get to the blood and cardiovascular chapters. But hemopoiesis, you'll also see hematopoiesis. Okay, hematopoiesis. Both hemo and hemato are prefixes that mean blood. Poiesis is a term that means the formation of. So hemo or hematopoiesis is the formation of blood that happens in the red bone marrow. Again, the yellow bone marrow is not hematopoietic, but is a space filler, essentially fat. Okay, so that's a little bit about bone tissue. Some of it is a slight review from the histology, and there were some new additional facts thrown in there as well. Let's get to the majority of what this lab's going to be about, and that is identifying bones. In you and me, there are 206 bones. The skeleton can be divided up into two large areas. You already know this from our first lab. when we talked about regions of the body. The axial versus the appendicular regions, or in this case, the axial skeleton and the appendicular skeleton. What this is referring to, right, is that the axis, the center of the body, the axial skeleton, is the bones of the skull and the face, of the vertebral column, of the thoracic cage. So we're referring to the center of the body. And then the appendicular skeleton is going to refer to the arms and the legs, the upper and lower limbs. And the question always is, well, where is the dividing line between the axial skeleton and the appendicular skeleton? And it turns out that the appendicular skeleton is not only the bones of the arms and legs, but also the bones that hold those arms and legs to the body. That means that the scapula, the clavicle, and the coxal bone are all considered part of the appendicular skeleton. So let's take a look at the axial skeleton first. Today you're going to be learning 200 of the 206 bones. The only 6 bones that we are not learning are the smallest bones in your body. They are found in the ear. You have 3 in each ear. And we'll wait and look at those bones in the nervous system chapter lab when we are looking at the ear structures. But everything else will be covered today and will be expected for you to learn. Now, 206 or 200 bones seems like a lot, but you're going to see there's a lot of repetition and a lot of bilateral structures, right? You have 2 arms and 2 legs. And so it isn't 206 different structures that you're learning today. Let's start off. So first, you're going to be looking at cranial bones. These are the 8 bones of the skull. Now, I'm not worried that you know that there are 8 bones in the skull. But I do want you to know that some of these bones appear singly, only one of them. And some of these bones, there's a pair. There are 2 of them. So that is one fact that I want you paying attention to as we go through this. So there is 1 frontal bone. There are 2 parietal bones, 2 temporal bones, 1 occipital bone, 1 sphenoid, and 1 ethmoid. And we're going to take a look at all these. Then there are 14 bones that make up the face. Most of them are paired, but there's only 1 vomer, and there's only 1 mandible. But the other ones are all double. You see there's 2 of them, left and right. There is 1 hyoid bone. This is the one bone that is not present on your 33-inch skeleton that you have. So every other bone is represented on your 33-inch skeleton except for the hyoid bone, which is found in the cervical throat region in the front. You have 24 vertebrae. We'll talk more about those in a moment. Broken up into 3 large groups, 7 cervical, 12 thoracic, and 5 lumbar vertebrae. You have only 1 sacrum and only 1 coccyx. You have 1 sternum, and then you have 12 pairs of ribs. So 24 of your 80 axial skeleton bones are simply ribs, and I will not be asking you to differentiate between the first rib and the 12th rib. As you look at your skeleton, you will notice there's a dramatic difference in the shape of the ribs. However, we're just going to call them ribs. We appreciate they all taste the same. So let's take a look at the vertebra. Okay, let's take a look at the vertebra. This is the one area of the skeleton that you will be expected to learn a little bit more about this week. We're going to save the other details for the next couple of weeks. But for this week, in addition to naming the 200 bones on the list, you also need to learn some of the substructures, or what we call the bony markings or the bone markings of the vertebra. So here is your vertebral column from a lateral view. And just a little way of remembering this, there is a cervical region, there's the thoracic region, there's the lumbar region. And you have 7 cervical vertebrae. They're numbered C1 through C7, very boring. There are 12 thoracic vertebrae, T1 through T12. And there are 5 lumbar vertebrae, L1 through L5. So one silly little way to remember this is perhaps you have breakfast at 7, lunch at 12, and dinner at 5. So just as a way of helping you remember, 7, 12, 5. Now you add those up and you see that there are in fact 24 vertebrae. 24 vertebrae. I'm going to give you a couple of facts about these vertebrae, then we're going to take a look at some images. So there are 3 types of vertebrae. You have the cervical, thoracic, and lumbar vertebrae. Now, if I were to say to you, where are the cervical vertebrae located? Very simply, you could say that the cervical vertebrae are located in the neck, because we know cervix means neck. The thoracic vertebra would be related to your thoracic cage, right? Your thoracic cage. So we could say thorax. But also, your thoracic vertebra have attached to them your 12 pairs of ribs. So you could also say this is your rib cage, right? As another way of thinking about the thoracic vertebra. They have the ribs attached to them. And then lumbar vertebra, we know, are, quote, in the back, right? So lower region. Okay, how many are there of each? Well, we just said we have breakfast at 7, we eat lunch at 12, and we have dinner at 5. So that is the number of these vertebrae, 7, 12, 5. And then I'm going to give you a couple interesting facts as we go through the next slides. So I'm going to give you a feature. You can come back and fill this in. But I'm going to give you a feature that will help you differentiate a cervical from a thoracic from a lumbar vertebra. You will be responsible for recognizing each of these vertebrae in isolation. So let's take a look. This is a typical vertebra. Here are the structures that you need to know about all vertebrae. All vertebrae have an opening, a hole down the center. This is where the spinal cord travels, and that is called the vertebral foramen. I mentioned we're going to see that word foramen a lot. So every vertebra has an opening, a foramen, a hole. And the spinal cord would be traveling through that. Remember, that would be considered part of your vertebral canal. Every vertebra has a body. Now, a couple of them have very small body structures, but this big solid region is called the body of the vertebra, and there is a soft gel-like substance inside that body that we'll talk about in lecture. A couple of other structures. On the posterior side or on the dorsal side, there is a spinous process. That is what you palpate down along the back. That is what's sticking out toward your backside, the spinous process. We'll see in our vocabulary that spine is a narrow structure, and process is a word we'll see a lot of as well. In bones, a process is something that sticks out. On the sides, there are transverse processes. So we see on the side, transverse processes. There's a couple of areas. One is called the lamina. The lamina is shown here circled. Okay, so basically it's the connection. The lamina is the connecting area between the spinous process and the transverse process. So if I draw this, right, I see a letter L, right? So the lamina is the area, right, that kind of goes, if you could draw a string around this, that'd be the lamina. And again, I can draw a letter L or a backwards L, right? 2 lamina. That is different from the pedicle. The pedicle is this region, okay? The pedicle, if I could draw a string around this or a piece of yarn, it would be in between the transverse process and the body. Okay, the transverse process and the body. That's where the pedicle is. And when I see that word pedal, I imagine I'm on a bicycle, right? My body needs to pedal, if you will. So it's just my crazy way of remembering. The pedicle is near the body, and the lamina is the section that allows me to draw a letter L. One more feature that I want to point out about this vertebra, this is not found on all vertebrae, but you can see right here there's an indentation. That is the indentation where a rib would attach. Okay, a rib would articulate here. And that white indentation is cartilage. So that'd be articulating cartilage. We know that that would be composed of hyaline cartilage. Now, the ribs only attach to the thoracic vertebra. So that is the giveaway. That is the absolute giveaway. When you see this divot and this cartilage in the transverse process, you can be assured that this is a thoracic vertebra. I'll give you another clue in a moment about how to tell them, but this is a great clue when looking at an image like this. Finally, and we'll see it in a moment in another angle, there is the superior articulating or articular process and facet. You hear facet or facet. And superior, this is a superior view of the vertebra. So we're looking down on it. So here is where it sticks out, right? It's a process. And a facet. Now, a facet or a facet is another term you already know. You know that if you go to Jared and you buy a multifaceted diamond, right? You're buying a diamond with a lot of flat sides on it. The more facets there are, the more that diamond shines. So you already know that the word facet or facet means a flat surface. So yes, this process sticks out. It's a process, but it has a flat surface on the top, facet or facet. We'll see there's also a inferior articulating process and an inferior articulating facet on the underside that's not visible in this view. Here's a view of another vertebra, and you will notice probably rather quickly that there are some significant differences. This is a cervical vertebra. Again, we're looking at it from a superior view. A couple of things that stick out to me is that there is still the body, right? We still have a body. Still have the spinous process, but notice that oftentimes in cervical vertebra, you'll see a split, a bifid spinous process. So you'll see sort of a split or a V shape there. There are still transverse processes, but they're not quite as distinctive. But most telling is this transverse foramen. You will only find transverse foramina in cervical vertebra. So write that down as the most distinctive difference between cervical vertebra and others is the presence of these additional transverse foramina. So here are the overall anatomical structures you need to be able to recognize in vertebra. You'll find a beautiful presentation of all of this in your lab manual and also in your lab atlas. But make sure that you can identify the following structures on those vertebrae. In lab, your lab instructor will be very pleased to go over anything that does not make sense from this list. But you should be able to point to the body, to the spinous process, to the transverse process, to both the superior and inferior articulating processes, which also have on them the facets, the vertebral foramen, the transverse foramen. Now keep in mind, those transverse foramen are only found on the cervical vertebra. The pedicle, the lamina. In between the vertebrae, one would find the intervertebral discs. That is that piece of fibrocartilage that's found between the bodies of the discs. Keep in mind that's more anterior. And you have seen fibrocartilage in the histology lab. And then in between the vertebra, there's an opening through which the spinal nerves emerge. And that is the intervertebral foramen. Remember, inter means between. So in between the vertebra, there's an opening. And you'll only see this particular structure when you are stacking two vertebrae on top of each other. Then you will see that intervertebral foramen, and that'll be from the side. You'll see it from either the left or the right side. There's one more special feature that I want to point out, and that is the dens. The dens is only found on C2, and the C2 is referred to as the axis. So you'll see the axis as a nickname for C2, and you'll see another nickname, atlas, for C1. The rest of the lab this week, your job is to learn and to identify the bones of the body. And what I want you to do, ideally, is to grab a couple of your favorite color highlighters. For this week, I want you to use one color and only one color of highlighter. This is just my suggestion. You don't have to follow this at all. But if you can start off this way, I think you'll enjoy the end result. So let's say yellow. Let's say we're going to use our yellow highlighter. And what I want you to use that highlighter, and I want you to label the bones. Notice that in this picture, there are a number of structures, but the bolded terms are the bones. So the frontal bone, the parietal bone, the temporal bone, the sphenoid bone, the ethmoid bone, the lacrimal bone, the nasal bone. Notice that I am not labeling the glabella or the infraorbital foramen. These are structures that you'll be learning about later in this lab and for the next couple of weeks. These are the bone markings, but your job today and the quiz next week will ask you to know the names of the bones. So your job is to learn the bone structures. So we don't need this week to learn these substructures, but you needed to know the ethmoid and the vomer, the inferior nasal concha, and the mandible. Those are the bones that are here. Now next week, what you might want to do is take your second favorite color of highlighter and use it now to label the bone markings, the substructures that we're going to ask you to learn. So I can tell you that we will be learning the mental foramen down here. So maybe you'll use a different color to label those bone markings that you'll find on the list. You will need to know the perpendicular plate. You will need to know, for example, the infraorbital foramen and the glabella. So those are structures you will be learning next week, but there are some structures on here that you're not going to have to learn. So by highlighting and getting into the habit of highlighting the bones in one color, the bone markings in a different color starting next week, I think you'll find that your diagrams are going to pop and you're going to have an easier time learning some of these things. Okay. Oh, you will also need to learn as we go through this the superior orbital fissure. But again, these are all going to make sense to you. Don't worry about those things now. I'm just showing you what your pages might look like in the future. Some of you have purchased flashcards, and those flashcards are fantastic. I just want to remind you that as we move forward in this lab, and in every lab in this course, we're going to be giving you a master list of things to learn, and many of those flashcards are going to have additional structures on them. For example, we are not going to ask you to know the superciliary arch, right? So that's something you won't have to learn about or highlight. My point is just keep your learning within the master list of things that we provide. So that is the skull. That's part of the axial skeleton. And then you'll also be learning the bones of the appendicular skeleton. Here we're learning all of them. So what are the appendicular bones? Well, the great news is they're all in pairs, right? We all have two legs. We all have two arms. And so all of the bones here are paired. So there's two clavicles. Right? There are two clavicles and two scapula and two humeruses and two radiuses and two ulnas. In your wrist, you have 8 different bones. You're going to learn each of those bones, but you have 2 each, left and right arm, left and right wrist. You have in each hand 5 long bones called the metacarpals. So there's 10 of those total. And then you have 28 phalanges. You have 14 on each limb. You have 14 of these bones in your right hand, 14 in your left hand. So that's 28. Where are we getting that from? Well, it turns out when you look at the hand, there are only 2 bones that make up the thumb. There are 3 bones, the proximal, the middle, and the distal phalanx, that are part of your other digits. So not 15, but 14 in each hand. You have 2 hip bones or coxal bones. Together they're called the ossicoxae. 2 femurs, 2 patellas, 2 tibia, 2 fibulas. 7 bones that make up your ankle. Those are called the tarsals as a group, but you'll learn each of those individual bones. Again, there are 5 bones in each foot, the metatarsals, and just like in your hands, there are 14 phalanges in each of your left and right feet. So those are the bones, and I think you'll find those to be really straightforward to learn. The bones that are probably the least familiar to you are the carpals and the tarsals, and I provided an additional handout in your lab folder to help you learn those. So, you have at your disposal an articulated skeleton. Each of you has been given one of these 33-inch skeletons to interact with over the semester. Throughout the lab and throughout the semester, we'll be giving you different activities to do with your skeleton. You have a series of stickers, colored stickers, and this week you'll be putting certain stickers on certain structures and uploading a picture of that to your instructor. We cannot take your articulated skeletons apart, but if we were in the lab, you would have a box of bones that you could have all the bones separated. This would be a disarticulated skeleton, and you should aim to being able to identify each of the bones individually. I'm not asking you to know the individual bones of the ribs. I'm not asking you to identify different ribs, and I'm not asking you to identify all of the 24 vertebrae. I do want you to recognize a cervical versus thoracic versus lumbar vertebra. But the rest of the bones are distinctive enough, you should be able to recognize them. Also, you would never be asked to identify the individual carpals or the individual tarsals on their own. When asked to identify those bones, you'll always be given an intact hand, an intact foot, and you'll be able to differentiate those bones based upon their relationship to each other. So I hope you'll enjoy learning about the bones and about the skeletal system.